Welcome to our second lecture series on hydrocephalus. We already dealt on the definition and the pathophysiology of hydrocephalus. For today, we will list the causes and risk factors associated with hydrocephalus. The causes of hydrocephalus includes the following. 1. Congenital causes. One of the primary causes of hydrocephalus is congenital, meaning it is present at birth. Congenital hydrocephalus often arises from various factors during fetal development, including genetic factors. In some cases, genetic mutations or family history can predispose an individual to hydrocephalus. Infections during pregnancy. Infections like rubella, toxoplasmosis, or cytomegalovirus contracted during pregnancy can impair the developing fetus's brain and lead to hydrocephalus. Structural abnormalities. Structural defects in the brain or spinal cord, such as neural tube defects, can disrupt the normal flow and absorption of CSF. 2. Acquired causes. Hydrocephalus can also be acquired, meaning it develops later in life due to specific factors. Head injury. Traumatic brain injuries resulting from accidents or falls can damage brain structures and obstruct CSF flow, leading to hydrocephalus. Infections. Infections like meningitis, which cause inflammation in the brain and its membranes, can block CSF pathways or increase CSF production. Hemorrhage. Bleeding within the brain, whether from an intracranial hemorrhage or vascular abnormalities, can interfere with the absorption or circulation of CSF. Tumors. Brain tumors, whether benign or malignant, can obstruct CSF flow by compressing ventricles or blocking passages. Inflammatory disorders. Conditions like autoimmune diseases or granulomatous diseases can affect CSF flow and absorption through inflammation. 3. Posthemorrhagic hydrocephalus in premature infants. Premature infants are at risk of developing hydrocephalus, particularly after intraventricular hemorrhages. The bleeding can lead to scarring and blockage within the ventricles, resulting in hydrocephalus. 4. Idiopathic causes. In some cases, hydrocephalus may develop without an apparent cause or as a result of complex interactions between genetic and environmental factors. This is referred to as idiopathic hydrocephalus. 5. Secondary hydrocephalus. Secondary hydrocephalus can occur as a complication of other medical conditions or interventions. For example, it can develop after a severe brain infection or as a post-surgical complication. The risk factors on the other hand points to activities or conditions that predisposes one to acquiring hydrocephalus or delivering a child with congenital hydrocephalus, and they include the following. 1. Congenital risk factors. Congenital hydrocephalus, present at birth, often has genetic or developmental risk factors, including genetic predisposition. A family history of hydrocephalus or genetic mutations may increase the risk. Maternal infections. Infections during pregnancy, such as rubella or cytomegalovirus, can harm fetal brain development, contributing to hydrocephalus. Neural tube defects. Structural abnormalities in the brain or spinal cord, such as neural tube defects, can disrupt CSF flow, raising the risk. 2. Premature birth. Premature infants are at a higher risk of developing hydrocephalus, particularly if they experience intraventricular hemorrhages, bleeding within the brain's ventricles. This bleeding can lead to scarring and obstruction of CSF pathways. 3. Infections. Certain infections can increase the risk of hydrocephalus, especially if they affect the brain or its membranes. Meningitis, for example, can cause inflammation that disrupts CSF circulation and absorption. 4. Brain tumors. Both benign and malignant brain tumors can obstruct CSF flow by compressing ventricles or blocking passages, leading to hydrocephalus. 5. Head injuries. Traumatic brain injuries resulting from accidents, falls, or other incidents can damage brain structures and obstruct CSF flow, increasing the risk of hydrocephalus. 6. Hemorrhages. Intracranial hemorrhages or bleeding within the brain can disrupt CSF pathways and contribute to hydrocephalus. 7. Other medical conditions. Certain medical conditions, such as autoimmune diseases or granulomatous diseases, can affect CSF flow and absorption through inflammation, potentially increasing the risk of hydrocephalus. 8. Surgical procedures. In some cases, surgical interventions within the brain or its membranes can lead to complications that result in hydrocephalus as a secondary condition. 9. Age and gender. While hydrocephalus can affect individuals of all ages and genders, some forms of the condition may have age-related risk factors. For example, normal pressure hydrocephalus (NPH) is more commonly observed in older adults. 10. Idiopathic cases. In certain instances, hydrocephalus may develop without any identifiable risk factors. These cases are referred to as idiopathic hydrocephalus. Thanks for watching. See you in our next video. Ensure to subscribe, like and share.